Hello.
Hey Michelle, how are you?
Good. How are you?
I'm really good. So good to see you.
Oh, I know. It's nice to be able to see you in person per se.
I know it's been a long time.
Exactly.
Yeah. So you doing okay?
Yeah, yes, busy, obviously. Just, busy with work and, work's a lot more, not necessarily a 9 to 5 anymore. So, pretty busy with that.
So what's it like to be the mom of young boys in the midst of a pandemic?
Well, it's been interesting because I'm trying to work and make sure they get on their Zooms, and they're both remote as well right now. So
So Connor and Brendan, how old are they?
Connor will be 15 in March. I can't even believe
I know. What grade is that?
he's in ninth grade this year.
Okay.
And then Brendan will be, he was 13 this past summer. So in July, he'll be 14 and he's in eighth grade.
Wow.
He's in middle school and Connor's in ninth grade at Ashland High School.
And so they're doing virtual classes.
They are, due to exposures and not enough staffing, they are now remote. In fact, the whole district went remote as of this past Monday. So
Yeah. Well, it's been interesting for us at the Ecclesia to see the kids sort of logging in on their own accounts, and they're probably used to that from school, right?
they are, we used to it was funny because a year ago, if we had to be home, we would all watch as a family. And now everyone's so used to, everyone has to have their own space in order to Zoom that now I Zoom in one room, Connor Zooms in another room. Sometimes Bill watches on the TV, Brendan goes in his room. So yeah, it's been
it's
interesting.
it's a little
You
different
know,
world, isn't it? Yeah.
it is true. I mean, the kids are used to it now. A year ago, when the whole Zoom, Google Meet situation started, it was very. I think it was a lot easier for the children than it was for us as adults. But now I think we're all
Well,
getting.
I take my hat off to you. I don't know how you and Bill and folks like you are doing it with young
Well,
children
thank
in
you.
school, and I think it's amazing. I wanted to share this conversation, sort of record this conversation, Michelle, because I think your family has a very unique perspective when it comes to COVID. You've certainly got a lot of experience. You have training and expertise. And I think you can bring a lot of value to our ecclesia, and really happy that you're able to spend some time with us this morning,
Thank you.
sharing some of that. So you're a nurse, and
That's
since
true.
April, you've been working with, is it the city of Framingham?
Yeah, the city of Framingham.
And so you're working with the Board of Health there as, what do they call it? A contact or contract tracer?
Contact tracer, because you
Contact
need to
tracer.
trace people who were contacts of people who have COVID.
Yeah. And so I really want to hear a lot. I want to hear more about this. But I wonder if first you could talk a little bit about your husband, Bill, and his experience. As I recall, Bill is a nursing home administrator. And I remember early on during the pandemic, Bill sort of raised his hand and volunteered to go work at a nursing home that had, I think, a very large population of COVID patients. What was that experience like?
Well, it was very difficult because, when COVID first, started to, be seen here in the United States, we had only heard of the experiences in Italy and China, and some of the other experiences. And, they were enough to, I think, scare us straight and really make us be concerned as we should be. And so one of the other nursing homes was needing assistance. And he said he felt like he had to be the one to raise his hand to help, because he said if the roles were reversed and it was his nursing home that needed help, he would hope that someone would raise their hand and help him in the same situation. So he actually went into a building. His building at the time, his own building, did not have any COVID cases, but he went into a building that was having a lot of difficulty with COVID. And so that was a difficult decision for him to make, because that meant, you know, that he obviously was going to be at higher risk. And at the time, there wasn't as much. There was PPE, but there wasn't as much PPE as there is now.
PPE is, explain that. That's personal protection.
Yeah, personal protective equipment.
Yeah.
So basically, I don't have the picture right in front of me, but I can send you just for if anyone's curious what he had to wear. He wore goggles, an N95 mask, a Tyvek suit, kind of like in the movie Ghostbusters. You know, he had like the complete suit, booties, and that was what he had to wear in order to work with the patients in the area where they were positive. Not every patient in the nursing home was positive, but you really have to consider, unfortunately these days, that everyone you meet could have COVID, because the reality is that may be the case. So even though he knew certain patients in the nursing home that he was volunteering to work in were positive, there was obviously many others that could contract COVID. So you had to consider that anyone you came across.
So when this happened, I think it was what, March or April? This is when.
Yeah. I think it was. Yeah, I'm a little fuzzy on the dates, but
yeah. So, you know, I remember, you know, being at the meeting house and reading out the announcements on Sunday morning. And, you know, I think there was one Sunday where I felt like I almost got emotional, you know, talking about Bill and the courage and the commitment that he had to his patients. I just thought it was a remarkable thing.
yeah, it gives me emotional to think about it now, but it was a difficult decision. And at first it wasn't a decision that we agreed upon.
Yeah.
Was not really.
I mean, it must have been hard, you know, he's the father of your boys and your husband, and, you know, he's going into
It was very
way.
hard because he, you know, some folks may not remember, but back in, it was 2011, May of 2011, he actually had Kawasaki disease, which is something that is unheard of in an adult. They actually asked if they had permission to write his situation up, because it's not something they usually see in adults, and it's something that can affect the heart. So he follows up with a cardiologist. So I'm concerned, particularly with him having experienced that a number of years ago, going into a building. He had to then stay at a hotel in the evening, and the only people that were staying at hotels at that time were healthcare workers. So he would go to the nursing home and then stay in the hotel. And then when he was done with that, then he also had a quarantine before he came home. Ironically, he actually did not get COVID that particular visit during
That time.
nursing home.
Yeah.
Yes, he did end up, you know, contracting COVID May 11th in his own nursing home.
Yeah, you know, it's at that time, if we think back, you know, what was that, 10 months ago?
Yeah, long
It
time.
was still new in the United States, and it's still scary. But personally, I've lost 4 clients to the disease, and I know that Bill lost a number of patients, and it's just tragic. So your family, Michele, has, you know, real firsthand experience, not just with Bill and his work caring for all of these patients, but you yourself. So tell us more about your job as a contact tracer. What do you do? How does it work? Fill us in a little bit on that.
Sure. So in Framingham, we're in a unique situation. Actually, the folks who live in Framingham are pretty lucky because we are all nurses. We're all, you know, registered nurses with, you know, different experiences. But the fact that we're all nurses, we're able to assess when we call someone. So what happens is when someone has a positive test or is identified as a contact, and a contact is someone that has COVID, that is a person is around that person that has COVID for 15 minutes or greater, 6 feet or less, with or without a mask. And that's 15 cumulative minutes.
So it doesn't have to be just like straight 15 minutes. If I spend 5 minutes with the person and then that's interrupted, and then I come back and spend another 5 minutes and then another 5 minutes, those 3 interactions total 15.
They used to think it was a 15-minute straight and then a guard in one of the jails had been near inmates that were positive only for a total of 17 minutes in his 8-hour shift, and different inmates, and not obviously for long periods of time. And that's when they realized
Right.
15 cumulative minutes in a 24-hour period.
Wow. And so you're getting all of this right from the Mass Department of Health, right? They're
Yes.
training you as a nurse, and
I have twice a week. It used to be twice a week trainings I was on Tuesdays and Fridays, and now every Tuesday I'm on a 90-minute training with the state epidemiologists. So the training's coming right from the Mass Department of Public Health.
so if someone tests positive, they tell the Board of Health in the town they live in. Is that right?
If someone tests positive, their test results go into a system. It's called Maven. And then Maven will send emails. We automatically receive emails for everyone who has an address listed in Framingham. And then each Board of Health will receive address, the test results for those folks who live in their town. So we receive all the folks who live in Framingham who were either positive or listed as a contact. And then what we do is we're like assigned, depending on how many cases we're willing to take. Obviously during the summer, the school nurses were able to take more cases. Now we're in school working as well. So you basically pick up the phone and you call someone and you start off the conversation. Usually I just say, I'm sorry to hear that you were diagnosed with COVID. How are you feeling?
What do these people sound like? Are they coughing when you speak to them? Are they wheezing?
It depends. I mean, everyone is different. When Bill had COVID, he said it felt like a really bad flu. He was sick with a fever. He had the fever straight for about 5 or 6 days, and he was coughing like really badly, to the point where he's never had an inhaler before. And the doctor actually ordered an inhaler that I went and picked up. And Bill, during his period of illness, actually stayed at a hotel. So I went and brought the inhaler, and we did a drop on one of the luggage carts, and I left it there. And then, he came, a minute later and, picked up the inhaler. So
these people, you're calling them and you're speaking to them and you're offering condolences. And then what do you do?
So then we have a list of symptoms that we're asking them about, and the symptoms are as much to see how they're doing as they are to see what COVID is doing to everyone, because again, it is so new. So we go through a list of symptoms, asking them if they've had any of these things, if they're still having these things, and how they're faring with them. And then obviously the fact that we're nurses, we're able to make suggestions and offer, medical advice. I mean, obviously we're not doctors, and we don't, tell people, anything sort of.
Sure.
Beyond.
So when you speak to them, how do they react? Are they afraid? Are they?
It depends. I mean, there are so many. We have a really large, diverse population in Framingham. We have folks who live in $1 million houses, and then we have folks who are undocumented, some living 10 and 11 in a 1-bedroom or 2-bedroom, apartment.
Wow.
It's, we have
what a scary thing with an infectious disease, huh?
It is a really scary thing, because in that situation, if they are living with multi-generational families or with roommate situations, oftentimes by the time we're even able to get them out to a hotel, most people in the house are ill. I'm sorry, tickle.
I hope that's a tickle.
I know, it's like you can't even cough. Like my allergies drive me crazy. It's like so funny. You go to the grocery store and cough, and everyone's like, "Oh my gosh."
Yeah. So also, if I understand it correctly, as a contact tracer, you're also trying to find out who they might have been in contact with.
Exactly. So,
and do you call those people too?
Yes, that's correct. So what we do is, in my situation, when Bill was sick, Bill gave obviously my name and the name of the children, because those were the people that he was in close contact with. And then, we had actually been socially distancing at the house, knowing that this was a possibility. So he had been sleeping in a separate bedroom, using a separate bathroom. And then when we ate our meals, we ate with him sitting 6 feet apart from us. So what we do is when we call folks, we ask them who they, and we explain what a contact is, about the 6 feet or less for 15 minutes or greater. And then we ask them about, who they've been at church with, who they maybe have gone out to eat with, who they work with, who they are playing sports with.
Mm.
We try to list a lot of different examples because
Almost prompting them to remember and recall.
exactly, because a lot of times if you get the, if you're feeling sick and you get the test a couple days later, the infectious period, if I were to test positive today, my infectious period is yesterday and the day before. So a lot of times you're trying to, what we do is we pull up a calendar and we list the dates and the days, and, we try to like cue them, asking them, oh, like, it was Sunday, did you go to church? Or it was Saturday, did you play soccer? Or did you go out to dinner? So we'll
So
ask.
you use the expression the infectious period. So I want to make sure I understand that. So even before I might show symptoms, if I've been exposed, I am infectious. Is that right?
Yes. So and again, this is a moving science where things are changing, but now they've pretty much figured that folks are infectious 2 days prior to their positive test or 2 days prior to feeling a symptom. So if today I start to feel a fever and a sore throat, I'm going to need to then think about who I spent Saturday and Sunday with, because that would be my infectious period.
So one of the reasons why I had asked you to join us on this call was because we had a situation at our ecclesia where we had a visitor that came, started to feel unwell Sunday evening. And so he would need to look backwards from the time he started feeling unwell over the 3 or 4 days prior to that.
It would be, if he started feeling unwell on Sunday, then he would be looking at Saturday and Friday as his infectious period.
Okay. So that's really interesting. So it shows how careful we need to be, because you might feel well, but you could be spreading it to others.
Exactly. There's two ways to spread it. Obviously, some people become sick and some people are what we call asymptomatic spreaders, where
Right.
they don't ever have symptoms. I had a woman who was going to Newton Wellesley just to have a minor surgery, and the hospital required her to have a COVID test.
Yeah.
And she felt completely fine. When I called her, she never had any symptoms, never had any sign of illness. The only way that we knew that she had COVID was she had a positive PCR COVID test.
Okay. So that's good to know. And we obviously need to take precautions. And I think everybody's probably pretty up to speed on the need to remain distant, to wear masks. Um, I think it can also be spread through touch, but maybe to a lesser extent. But, if we come into our church building, the meeting house, we've got, the hand sanitizers and we're trying to maintain distance. When you're watching online, Michele, what advice as a professional or a guidance could you give us to sort of improve things? So one thing that I notice is, sometimes we tend to congregate in the aisle, and we need to be especially careful of that. What else?
So it's really hard because one of the things that I remember from when I was a little girl coming to Stoughton, for years, is we loved to hug and we loved to kiss. We're not doing that right now, which
Right, that's
is
for sure. Yeah.
yeah, exactly. And that's wonderful. But I think the other thing, we need to do is remember that, COVID isn't anything, for the rich or for the poor, for the bad, for the good. I mean, COVID just is something that, anyone could have. I mean, I could later this afternoon feel ill and I could be diagnosed with COVID. So it's really important for people to remember to be in with their family. If you're not living with someone, then you should be socially distanced and in a situation where try to stay amongst your family, both sitting in the pews and as well as the after meeting activities. I know sometimes, I remember I was telling Steve offline when we were getting together, both my grandmothers used to love to have everyone over who didn't have a place to go after meeting.
Right.
And that's wonderful. And that's something that, hopefully we'll be able to do in a year or so, but it obviously is a higher risk if I were to say just to the Davises, hey, let's all go out to lunch together. And have a wonderful meal, because obviously you're taking off your masks and you're having an hour of visiting and talking, and, talking and singing, and just breathing, can spread the COVID if we were to have it. So it's really hard we want to get together with everyone, but as best as possible, stay within your family units, both in and out of the meeting, because
Yeah.
it's
So
just,
certainly, there's a real need people feel to have this sort of personal interaction. And I think early on, my experience is that people were a little bit more diligent. And I sense that there's this COVID fatigue. Could you talk a little bit about that?
absolutely. We actually use that term, the COVID fatigue, a lot in our line of work. And what we found is, when this first happened in March, there was no sports, there was no school, there was no restaurants, you couldn't get your hair cut, you really couldn't do anything. So people were really staying in their own homes, and it was still cold out, so they weren't minding. But then as time went on, people were feeling less and less wanting to follow the rules. Some people, just for the fact that they had been following the rules for a couple months, and they felt like nothing bad happened to them or their family or someone they knew, so things should be okay. And then the other thing is, it got warmer, so people were, when it's 100 degrees, it is hard to wear a mask.
Right.
We actually drove out west to Utah. It was 110 degrees and we wore our masks. And I can tell you, it was very warm, but at the same time, it was safe. And I think it's hard because, like you said, it's been really, we went remote March 12th, I believe, in Framingham. So we've already had our 9 months, full 9 months of being remote, off and on. Some of those children haven't been in school and haven't seen each other. So people are they're wanting to get together. We just had Thanksgiving, Christmas is obviously coming up, Hanukkah is happening right now for those who celebrate Hanukkah. So it's very difficult to not want to finally start to get together. But I think we need to remember the numbers are rising greatly.
Are they so you have these calls every Tuesday and they bring you up to speed on these things? Are we seeing a real uptick? Is it
A huge uptick.
yeah. And this is
We
right after the sort of the 2 weeks after Thanksgiving, and it's really sort of
Even
exploded.
prior to that, we were seeing an increase, but we've had a tremendous amount of increase. I think it's 4 to 5 times what we had a month and a half ago, we have today. And they call it percent positivity. And it's a real concern because if, like we talked about before, with people being asymptomatic, it's not just the people that are walking around coughing who should be home. There are some of those. There's also people who feel fine, who don't know they have COVID, that could be going over and getting together. We have a friend of the family who they chose to have a larger family get together for Thanksgiving. And unfortunately, that particular whole family is all now sick with COVID. So
Scary, isn't it?
it is scary, and we all still love each other, but it just is better, I hate to say it, but to love each other on Zoom. And,
Yeah. Yeah,
lots of,
what would we do, right? I mean, I think, we've got our Wednesday night class and we've got, sometimes 100 families joining, and on Sundays the same. And it's just I think it is a way that we can feel some sense of connection and belonging without doing it in person. It might not be as good, it may not be, the ideal, but it's something.
yeah,
And
I mean, unfortunately, it makes a lot of clinical sense. And that's the hard thing for folks is, who maybe aren't science-based, or maybe are lucky enough that they haven't seen it in their own personal situations. When we were talking about, my husband, Bill, he was diagnosed on May 11th. Bill was feeling fine by Memorial Day weekend. A coworker of Bill's was diagnosed on May 12th. She has passed away within a month. She passed away, her brother passed away, and her mother passed away, all from COVID. And, so it's really, it's a real situation for those who have been lucky enough not to see COVID up close and personal. I can assure you, it is out there. I talked to
and as members of a real close-knit community, a church community, an ecclesial community, we've got to be particularly careful because we have this this could just devastate and decimate our ecclesia. So as a professional, somebody who's got not only firsthand experience, but you've got the expertise, are there any specific recommendations you'd make for our members who are watching this? I would imagine that if people are susceptible or have, limitations with regard to their health, they ought to be especially careful, right?
Very much so. People who have any sort of what you would call any sort of illness that would make you at risk, for the flu or for a cold being worse than your peers, then obviously you want to be careful. Young children, especially those children who, cannot be or are not currently immunized, there are concerns. I think the really thing we have to look at is COVID is so new, so we don't know what the implications are for long term. There could be long term, heart and lung issues for people with COVID. So I think we just need to be really cautious. And if you are feeling sick at all, or if your children are feeling sick, when in doubt, be tested. If you go to Stop the Spread Massachusetts, there's a list of free and there's no copay required sites. I've actually been to one of those myself. And then there's also other places that, might have a copay that you can be tested. But there are throughout Massachusetts places that you can be tested completely free, no insurance required.
And where do you find that Stop the Spread?
If you go to Stop the Spread Massachusetts, if you Google that, you'll find they'll list towns. Obviously, there are towns that have a greater amount of COVID, and they have different sites. I know in Framingham, we have 3 sites. Actually, I shouldn't say that because one just closed on Friday. So now we have 2 sites. One you can make an appointment at, and one is a walk-up for some folks who don't have a car. But being tested is really important. Don't think anything's a cold or flu or something minor. If you feel any signs of illness, or even if you aren't feeling ill and you just want to be safe, it's important to be tested.
And you're not just doing it, you're not testing just for yourself. You're testing
no,
for people you might come in contact.
Exactly. You're testing
We've
for
got
your
a lot of
loved ones.
people within our ecclesia that are susceptible. And so,
of course,
I think that what I hear you saying is, if you've got any questions, stay home, watch on Zoom.
Absolutely. Please don't come in.
There's nothing wrong with that, brothers and sisters,
No.
right? I mean,
No, I mean, I miss everyone, but I'm working in,
yeah.
Now that we're remote, we can discuss it, but my boys still play hockey, and, there's always a risk, and I don't want to be the one that is bringing COVID into the meeting. So unfortunately, I haven't been in, and I've been watching on Zoom, but I think the Zoom experience.
Well, it's great to see you today, that's for sure.
Exactly.
So let me say this, Michele, as we're talking, today is Monday, the 14th. And this very day, trucks are sort of fanning out across the United States, carrying the very first of the COVID vaccines. I was talking with my friend, brother Seth Dillingham, and Seth was like, it's amazing. It's almost like this Hollywood drama where you've got this exploding rise of COVID cases, and at the same time, you've got the vaccine finally coming out, and it's like this big suspense, what's going to happen? What are your views about the vaccine? Is this something that we should be taking? Fill us in on your thoughts on that.
Sure. Actually, the nursing home that Bill's at is going to be getting the vaccine. I think same thing on those trucks that Seth was talking about.
Okay. Yeah. Wow.
Coming any day now.
Yeah.
And as a healthcare worker, he will also be able to. So honestly, I would, if the vaccine were available today, I would be vaccinated. I know that, some folks have concerns. I get my flu shot every year. And despite, I work with people, teachers and just other people to say, I got sick from the flu. I'm like, no, you were actually sick. And, you just have.
It wasn't related to the vaccine.
Exactly. So, I think it's worth, having your flu shot if you haven't done that already. And also if your doctor feels that it's appropriate for you to get the COVID vaccine, to get that as well, because.
Okay. So let's wrap up. So we're at about 30 minutes.
Oh, goodness.
So this has really been great. I think you and your family, as I say, you just bring such an expertise to the ecclesia, and we're really happy about that. So thank you.
Oh, thank you.
In terms of action steps, you know, if you are attending, first thing is if you have any suspicion that you're sick or you've been exposed, don't come to meeting. If you are susceptible to the COVID or if you've got some sort of pre-existing conditions, participate in the meeting online. You know, take care of those that you're with. If you're at the meeting, stay 6 feet apart. Don't congregate in the aisles. If you're going to chat with each other, do it outdoors, not, you know, close together. I think we're all on the same page there.
Absolutely. Yes, everything you've said is correct.
Okay. Then
And
in
then go
terms of,
home and enjoy your meal at home and call your friends or this.
yeah,
Great.
yeah, okay. And then in terms of exposure, if you've been exposed, know that you need to isolate.
Yes, yes.
Don't be afraid to get tested. The testing is free. You can go to, what's the site again?
Stop the Spread, Massachusetts.
Okay, so we can go there, find the testing sites, get tested. I think that's it. Was there anything else that you wanted to share?
No, I mean, the testing isn't, it used to be, everyone thought it was really scary. A lot of them are self swabs now. So it's, you know, I think people were not getting tested because they were a little nervous about the whole, you know, nasal swab situation, but they're a lot better than they were in the beginning. So definitely get tested.
Well, Michele, thank you very much today. This has really been helpful for us.
Welcome.
What I'd like to do is send this recording out to the ecclesia. I know that you were really good to put together some slides, which I will also include
wonderful.
in
Thank
the
you.
email. And this will give us the ability to go through and see some more information. Brothers and sisters, if you've got questions, you can reach out to me or directly to Michele. I'm sure she'll be really happy to help us. And as we wait for the vaccine, I think we have a greater anticipation that we can wait for the return of Jesus.
Absolutely.
And, you know, the world will be, you know, the problems in the world will be resolved. But in the meantime, we remain vigilant in our faith and we remain vigilant in taking care of each other. And this is just part of that. Michele, anything else you want to add?
No, I will send you my cell phone number, which I didn't realize wasn't in the ecclesial directory, to make sure everyone has it. If anyone has any questions, feel free to call me.
Okay. Thanks again, Michele. Great to see you. And,
great to see you.
Really.
Give my best to your family.
Okay. All right. Lots of love. Yep. Bye for now.
Take care.
Yep.
Bye.
Bye-bye.